I'm Dr. Derek Moore. I'm an orthopedic surgeon with orthopedics and sports medicine at the Longstreet Clinic. I grew up in upstate South Carolina. I went to Clemson University and finished with a civil engineering degree. I actually practiced for a couple of years with the Department of Transportation there, and then went to medical school at the University of South Carolina. Finished there and then went to Greenville, South Carolina for an orthopedic residency, including some time at the Shriners Hospital there, and then after that came to Gainesville, Georgia to practice. When I was young, I had several encounters with the orthopedic surgeons in my hometown. I broke my wrist when I was fascinated because my friend's father was the orthopedic surgeon in town, and I watched the remodeling of my own arm, which was fascinating. The second was I've always enjoyed taking things apart and putting them back together. So rebuilding those things was fascinating to me. I grew up in the era of boxes arriving at the front door, and I would dash through dinner and assemble them before anybody else could get to them. So I've always enjoyed putting things together and fixing them. And then probably the biggest, my mother had a bad car accident, and she broke her ankle and went through 4 different surgeries to reconstruct it, realign it. And watching that and the way that she went from being unable to walk to being back jogging, playing tennis was just fascinating to me. What I like best is meeting someone who's having pain, having problem. Maybe they can't even walk if they've broken something. So you meet somebody at what is not their best point in life, and you can work through a plan how you can help them, how you can restore their shoulder function, their knee, get them up and walking. And it's really rewarding if the first time they are able to come back in a follow-up and they can walk, or they can, they tell you that I'm back at work, I can lift things, I can do things. That's what I enjoy the most, is seeing the smile on the face to say, I'm better and thank you for helping me get there. The thing that's best about the North Patient Tower is not only is everything updated and modern, but everything is contained together. You come in the entrance there, you do your pre-registration on the first floor, go right upstairs to the second floor where the surgery is. If it's an outpatient surgery, it's not far at all to go right back to your car when you're done. If you're staying in the hospital as an inpatient, 2 floors up on the elevator, you've got the entire rehab facility, you've got physical therapy, you've got the nursing, you've got everything you need to recover from your surgery. And then again, it's convenient to pull right up to the front door and head out when you're ready to go. We've been able to put through what we need as orthopedic surgeons as far as the request when they built the new operating rooms. We have the latest in arthroscopy equipment, the latest in trauma equipment, the latest in joint replacement. It's all right there. Everything was designed. We have a whole section of operating rooms that are orthopedics, so everything we need really to perform that is all contained together. So unlike the former operating room where it had been added on so many times that some things were this place, some places were the other, now everything's all together, it's streamlined, and it's very nice. The rooms are brand new, and they have the latest technology on nursing equipment and rehab too. We've worked with the same nursing staff for even before we moved into the North Patient Tower, so they're familiar with us. They know how we practice, despite the fact that we're orthopedic surgeons, we're all individuals, so each of us has different preferences, and we tend to work with the same group of people week in and week out. So they know what we need, they know how we take care of people individually, and so there's that comfort level. They've been doing it long enough that they're confident with what we're going to do, and we're confident with how they're going to help us get through surgery. And then from a floor standpoint for rehabilitation, the physical therapy staff, as we each have designed our own rehabilitation protocols, so they know what we expect after joint replacements or hip fractures, how we want to recover with our patients. And the nursing staff too, the entire 4th floor is dedicated to orthopedics and neurosurgery, so they're completely familiar with the type of surgery that we do and what we expect from our patients from a recovery standpoint. I think I take a good bit of time with my patients, listen to what their problem is, what's bothering them, And then I think you have to factor in what goes on around them. You know, do they have issues with children? Do they have issues with parents that they take care of? It's becoming much more common. An older adult, you know, they may not have someone around to help them at home, or they may have a spouse who can't help them up out of a chair. So you have to look into all of the social aspects of, you know, what contributes to their injury or their illness. And then you also look specifically at what they have. You know, what can they not do that they need to do? What are their goals? Do they need pain control? Do they need to be stronger? Do they need to be able to get around better? You know, what can we do to help them get where they want to get? So I think that my philosophy is to work with a patient and come up with a plan that works for everybody. I've been now, even before we merged with Longstreet Clinic, I've been with the same, 4 of the 5 of us have been here for at least 8 years, and our newest partner has already been here a couple of years. So we've worked together. We each have strengths. We all do what we consider general orthopedics, but each of us has various strengths. I do more of the upper extremity and work injuries. We have people who can specialize in, you know, joint replacement, sports, foot and ankle, so we're able to take care of each portion of orthopedics, and also having someone who, if there's a more complicated case in one particular specialty, we have that support from our partners. As I mentioned, I grew up in South Carolina, so I attend a good many college football games in Clemson, so I enjoy that. I'm a Boy Scout leader, so I've been on several of the high adventure trips with my son, who's now a 3rd-generation Eagle Scout, so we're certainly proud of that. My daughter enjoys playing the viola, and then I have 2 stepdaughters, one who enjoys art and one who enjoys running track. I like to play tennis, to hike, to be outdoors. From a Gainesville standpoint, what attracted me here was the mountains, the lakes. It's similar to the area where I grew up, so I enjoy being able to do all the outdoor activities, and certainly being in the mountains, looking down at the lakes is a beautiful way to spend a Sunday afternoon.